Funding for This Is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm LaTanya Turner, and this is Nashville. Think of 5 people you know, and chances are at least one of them is providing unpaid, often unseen work of caring for another adult, probably an older parent or relative. That's according to a report from the National Alliance for Caregiving. And many are also taking care of children or other family members while holding down a regular job. These family caregivers are increasing in number, partly due to more people living to an age where they need help with daily activities. In our series, Next Age, we're having conversations about growing older and the effort to reframe aging in a way that helps all of us. Caregiving is an important part of that discussion. This series is made possible thanks in part to Blue Cross Blue Shield of Tennessee and the Weston Home Foundation. So who are family caregivers? Well, most are women in their 50s, and for many, it's a role they never expected or prepared for. All of that sets up the story I'll share with you now about a local family caregiver who let me visit her home and tell her story.
How are you? This is my mother, Joanne.
Hi, Miss Joanne.
How are you?
All right. Nice to meet you.
My name is Kenny Watkins. I am my mother's caregiver. I have been caring for her for 2.5 years.
Visiting you early in the morning. Is that okay?
Yes, ma'am. She was diagnosed with vascular dementia, and we made the switch from Chattanooga to move her here. Come on up. No, you come on. You come on out. No, come this way. Come this way. Sit here. Sit here at the table and get your breakfast. It was drastic for me, just because I was at a place in my life. I had been a single parent. He was older, soon to be graduating. He was driving, things of that nature. And so now...
You were about to have an empty nest.
I was about to have an empty nest because I had my own thoughts and goals of things that I wanted to do, that I knew that wasn't going to happen, at least not right away, because I had to be a caregiver. This new life of not just taking care of my mother, but taking care of a shell of my mother who was no longer coherent enough to even know who I was or know who I am today.
Had you and your mother ever talked about how she would age?
No, not at all. I did not see this coming. What I did see coming was heart disease, because she was a heart patient. Her mother died of a heart attack. She herself is a triple bypass patient.
If anyone maybe should kind of have known, I would have said someone like you. You were in healthcare finance. Have you ever thought about that?
I was on the reimbursement side of it. So I never thought about aging perspective, never thought about that. You want some apple juice or some orange juice?
Orange juice would be fine.
You chose to be her sole caregiver. Why did you feel so strongly about that and not hiring people or placing her somewhere?
And I get emotional when I say this. God gave me a great mother. I am a mama's girl. Talking to her 2 and 3 times a day, that was my girl. And so for me, there was no other choice. We were built to take care of our own.
Since she's just sitting here and seemed to be enjoying my company, I was going to talk to her.
You can definitely get it, because you just never know what you may get afterwards. So,
okay. Tell me how long you've been living with Kenya.
Well, that's been so I forgot how long it's been myself.
Okay.
Yeah. How long has it been?
Almost 3 years.
3 years?
Mm-hmm. And what's my name?
What's your name?
Mm-hmm.
Your name is Flower.
Hmm?
Flower.
Okay.
There's, you know what, I don't even know what your real name is.
So okay.
What's her real name? I know her real name, but I can't get it out.
Dementia has a lot of different faces. And I had to learn that the hard way. My mother is being stripped of her gracefully aging process.
I can't get it out.
My name is Kenya Nicole Watkins.
That sure is.
And who is she to you?
She is, at this point in my life, she is my heart. I live in her house without paying a bill, so that's just one thing to just say, period. Yeah, there are many things that she does.
It's good to have somebody like that.
Yes, it is. It is. And it helps you if you actually take your time out to I can't get it out right.
Well, that's okay. You don't have to. I'm just making conversation.
Yeah, I should be able to, though.
I've gotten used to the situation. I think going forward, there will be guilt. There will be, am I doing the right thing? Am I enough for her? No, we're going to come to your room. God willing, we're all going to age, if that is the plan that he has for us. And age in a place where you can't take care of yourself. Pull the cover up this way. This isn't part of curriculum that you're taught in school. Right. How do we better educate our children of different policies and plans, and how much conversation is really going into talking about aging? You want to lay down?
Not right now.
Okay. Come this way.
So Kenya asked, how much conversation is there about aging, and what should we expect? How should we plan for long-term care? And she's here now in the studio to talk more about that. Welcome, Kenya. Thanks for joining me.
Thank you for having me.
And thanks for allowing me to spend some time with you and your mother and share your journey as a caregiver. How's your mom doing? Let's start with that.
Mom is doing okay.
Okay. I really enjoyed getting to meet her.
Thank you.
How do you talk about aging since becoming a caregiver for your mother? How do you think about your own aging?
I think that we have to ensure that, one, we are prioritizing our own mental health and understanding that aging comes quicker with stress and trying to minimize that as best as possible. Talking about long-term health insurance and, and what that coverage looks like. So if and when my time comes and I should be, not necessarily in the position of dementia or some type of mental, illness, but just aging in itself, what that can look like for my son, and trying not to be as much of a, I try not to use the word burden, because in no way is my mother a burden. However, there are areas that come with caregiving that are frustrating. So if I can minimize the frustration that my son or someone else in my family, may have to experience due to my aging, I want to do that as best as I can.
Are there specific things that you're doing? And your son is a young adult, correct?
Yes.
A college student?
He is.
Okay. So he's old enough for you to have these conversations
Yes.
with some understanding. So what are you talking to him about?
I am talking to him about my goal of setting up some type of monetary stipend for me, and the plans that I have for that with my savings. Talking to him about, my life insurance policies and making sure that he is aware of what those things consist of, where they are, how to access them, and understanding what my want, or what my expectation of him as my son. And I tell him all the time, do what the Lord will lead you to do as it relates to taking care of me. By no means do I want you to uproot your life. Do I want you to be in a position where you have to stop your life? No, I don't want that. my hope is that, God blesses you with enough money, enough finances, even if my little policy doesn't, hold up. But put me somewhere nice. Make sure you come and see me, on a regular basis. But, I want you to live, because I would hope that my life, I had lived a good life, and I'm okay with being somewhere to allow you to live your life. So those are the conversations that we have.
Okay. And a lot of this is, as we talked about in the story, even with your professional knowledge, you've had to learn this as you went, correct?
Absolutely. Absolutely. As shared before, on the professional side of things, though I was in healthcare, I dealt with reimbursement. So I saw, the claims and how much it costs for certain medications or certain visits and things of that nature. But none of that made me think about, looking at the age of some of these people and saying, well, this person is in their 50s, 60s, or 70s or whatever, to really think about that. Again, God willing, one day I hope to be there and what that looks like for me. So just thinking in terms of being in healthcare and on one side of it, how perhaps not looking at the whole totality of healthcare caught me off guard in trying to now find things and figure out things about my mother's, healthcare, and even planning for my own, and even helping others, around me, my peers who are experiencing, some of the same things that I'm going through, with their aging parents.
Well, you're certainly not alone in trying to navigate this process. And so many family caregivers are figuring things out as they go, but there are a growing number of resources aimed at helping them. And one of them is the idea of coaching caregivers. Joining us now is Tiffany Cloud-Mann, an elder care coach with AgeWell Middle Tennessee. Welcome, Tiffany.
Thank you for having me.
So what is an elder care coach?
So an elder care coach is an idea, a program that came out of AgeWell about 5 years ago. And it's really a navigator. We need navigators to, point us in directions, tell us what to expect, where to go. And so elder care coach is for caregivers that might have their loved one living with them, or maybe their loved one's living in a assisted living or memory care, or maybe they're a long distance caregiver, and it's someone they can call for coaching, someone that they can tell their story to, their pain points. They can say, hey, I don't even know what I need to know. And that navigator or that coach can help them get a plan for going forward.
I saw you nodding quite a bit when Kenya was talking. I mean, obviously a very well-educated, professional woman, but so that doesn't seem to be necessarily helpful when it comes to being in this role of family caregiver. Is that a familiar story to you?
Yeah, absolutely. I mean, I always say if I wasn't in this field, I wouldn't really know a lot either. And even still, there are things that in terms of planning with my parents that I haven't done, even though this is what I do for a living. So, I think, sometimes we think it's human nature to think, oh, that's not going to happen to me, or we're never going to get in that position. But it's also just, hey, I don't know about these things because this isn't what I talk about or do every day. And so, yes, many people are in that same position.
And tell us a little bit about why the numbers are increasing.
Yeah.
I mean, it obviously has to do with longevity.
Yeah.
But does it also have to do with policy and support services?
Yeah. Well, definitely, we have the older aging population, our baby boomers, 10,000 turning 65 through the end of this decade. And so with age, obviously, like you said, I think comes more chronic disease and health needs. And so therefore, many more people are going to need care. I also think we are starting to help people recognize, hey, I am a caregiver. Sometimes we just think, oh, we're just doing what we are supposed to do or should do. And
kind of sneaks up on people, doesn't it?
Yeah. And I think, if you don't identify as a caregiver, you're probably not going to reach out for resources, support, and education. And so, we're trying to help people recognize, yeah, you are a caregiver. Even if you're a long distance person and you're giving of yourself emotionally or your time to help make mom or dad doctor's appointments, that still makes you a caregiver. So I just think, again, many more people aging. We're hopefully helping people recognize that that's the position they're in. And unfortunately, there's a lot of gaps to fill, especially in Tennessee, with supporting caregivers. And so those needs are high. They need support.
People can call you
Yes.
to get this navigation support. So
Yes.
what are some of the common requests you get?
Yeah. So a lot of times the question is, how do I know when to seek out a higher level of care for my loved one? How do I know when to make a change? I maybe feel like they might be unsafe, or are they getting their needs met? How do I know when to make a change? Other common topics might be, I'm just really burnt out and I need to know what help is out there to get me a break. And then I've heard of assisted living, or I've heard of memory care. What is it? How do you pay for it? So people just trying to understand the resources, and, elder care coaches for people that are in crisis, but also caregivers who maybe don't even think they're a caregiver yet, but they're approaching that role and they want to know what they need to know.
Okay.
Yeah.
And one of those resources is, in part, how I found out about Kenya, the Tennessee Caregiver Coalition. Tell me a little bit about that, Kenya, and the support group that you're a part of.
Okay. Well, I am, as you said, a part of Tennessee Caregiver Coalition, and they are a great source of information. Not only are there support groups that I am a part of, but there are also 2 services that will, help with respite. So I definitely encourage, anyone out there who is seeking respite, seeking information about caregiver support, to reach out to Tennessee Caregiver Coalition and let them walk you through, all of the resources that are available to them. And so it's been great for me. It's been a great opportunity for me to meet other caregivers, not only locally, but just here, in the state of Tennessee, and listen to the different resources that everyone has access to and the sharing of those resources. And so it's been a great being part of that world, that coalition world.
And has it helped you overcome the guilt that you mentioned might be coming?
I'm not going to say really overcoming it, but understanding that, what you're going to feel is going to be natural. When you love someone, you want to make sure you're doing right by them. And so, anytime you're thinking about, not taking care of someone that you love or putting them in the hands of someone else, I don't know if that really just leaves you, but it gives a support of understanding that if that is a decision that you feel that you need to make for your own, mental, needs, then it's okay to do that. And, and know that there are a group of people who are feeling, the same things that you're feeling, wrestling with the possible guilt or the even guilt of doing, just that, So it's been a help.
Okay. Just have about a minute left, Tiffany, but I do want to mention the program that you have with companies and organizations, because a lot of caregivers need that support from employers and organizations they're involved with. Can you just quickly tell us about that?
Yes. Well, and I didn't mention this, but so, the federal workforce is about 3 million people. Today, there are about 53 million caregivers. So they really are the backbone of the workforce, and more than half are working. And so we are partnering with employers to bring them this very low-cost turnkey benefit solution to support their caregiving employees so that they can focus on work when they're at work and have the resources they need.
Okay. Thank you both very much. We're going to have to take a break. Thanks to Kenya Watkins and Tiffany Cloudman for talking with me today. When we come back, we'll have a couple of guests to discuss strategies for the so-called sandwich generation caregiver and how to maintain emotional and physical well-being while also addressing grief that comes with loss of a loved one in your care. We'll be right back.
Sometimes in our lives, we all have pain, we all have sorrow, but if we are wise, we know that there's always tomorrow. Lean on me when you're not strong, and I'll be your friend.
Funding for This Is Nashville comes from Nobody Trashes Tennessee, the state of Tennessee's official litter prevention campaign, managed by TDOT. Details on how to be part of the solution to end littering at nobodytrashestennessee.com. Funding for This Is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
Turner, and this is Nashville. Today, we're continuing our series Next Age with conversations from and about family caregivers. You may have heard the term sandwich generation caregiver, someone who's taking care of an older parent or relative while also caring for children and working full-time. That's the experience of Carrie Pagetta, who is here with me now in the studio. Carrie is one of our colleagues here at Nashville Public Radio. She's also a wife and mother of young twin daughters. Welcome, and thanks for joining us.
Thanks, LaTanya. Thanks for having me.
So, full disclosure, before we get started, we should let our listeners know that your caregiver journey recently ended with the passing of your mother. So, my condolences.
Thank you. Thank you so much.
But you're still very committed to being a guest on the show. You told me you really want to talk about your experience as a caregiver. So explain why that is.
Well, I think because that season of our lives just hit kind of suddenly. It seemed to be suddenly anyway. And while it's still so new and so fresh, I thought I might be able to offer some insight or some words of comfort to people going through it themselves.
Okay. Your experience, from what you told me, was a little more gradual. Like Kenya kind of suddenly had to move her mother from Chattanooga, et cetera. But yours started off very differently, didn't it? Tell us about that.
It did. So when our twins, we call them the ladies, when they were a year old, my mom moved in with us to help. My husband is from a multi-generational family. They all live together. And so he was very familiar with that setup and welcomed her. And, it really worked for us. And then when my mom started having, she was diagnosed, it took a couple of years for the diagnosis, but she had focal impairment seizures, which she would just zone out and kind of lose memory. And then some of that memory was lost forever. That started in 2022. She had moved in with us in 2017. So we were there as the safety net to support her. And also through the pandemic, too. She lived with us, and she had those seizure episodes about every 6 weeks. And so we finally got her with a neurologist in I think it was May of 2022. And then that, journey progressed to then the cancer diagnosis in 2023.
So went from someone who was just almost like a live-in relative, helping out, enjoying family connections, and then the roles flipped and you became a caregiver. And you were also taking care of young daughters. How was that, balancing those roles?
Well, at first it was wonderful because we had that extra set of hands built in, and so it was a great comfort and support to have my mom there with us. But when the roles switched and the caregiving of my children and my mom heightened and grew, it was really challenging, to be honest. I mean, I felt like sometimes a split person, unable to fully be present for either side of the world of caregiving.
How did your girls cope? The ladies.
They were troopers all throughout. They saw, especially these last few months, they saw their grandmother and saw her, they called her Honey. They saw Honey's journey, and they stepped in to help when they could.
And you also have a spouse that's very helpful.
Yes,
Joe.
yes, he's wonderful. Yeah, and we were there, and like at one point towards the end, we were like, can we continue this and keep her home? At that point, she was in hospice. And they were a blessing in themselves, the hospice nurses and staff. And, we really, it was important to us to have her there, comfortable as possible, surrounded by love. My brothers and sisters-in-law were coming in and out of the house at that point, and everyone was pitching in.
Okay. Well, as with Carrie, the caregiving journey often comes to an end with the passing of the care recipient. Our next guest has expertise in strategies and support for people who are caring for older relatives as well as children or other family members. Dr. Phelan Lewis is a dean at Vanderbilt University School of Nursing, and today she's here to talk about her extensive research on caregiving. Welcome, Dr. Lewis. Thank you for being with us today.
Thank you so much for having me.
So your work in the area of caregiving in this area is part of the National Alliance for Caregiving Research Collaborative. What is that? And tell us a little bit about some of your findings.
Sure. So the National Alliance for Caregiving, it's a national organization, and they work to support caregivers across our country with policy, supportive programming, and really trying to advance the message that our family caregivers need support. They are in dire situations. We know from the stories that we've heard today, we know that they're under immense stress, exhaustion, the economic impacts from caregiving. There's so much that our family caregivers are giving selflessly to our country, to our economy. They really are upholding a broken health and social care system. And so that's what the NAC does. It gathers around researchers from around the country who are committed and invested to advancing this work.
And we said earlier in the show that these folks are often unseen. And I will say that Carrie has been doing a yeoman's job here at Nashville Public Radio, and many people didn't even know she was on this journey. So that is often the case, and yet the numbers are growing. Right?
That's right. Yes. So we say there's about 53 million family caregivers around this country. And of that, we also have to keep in mind those that are young adults who are also in university or in graduate school. We think there's about 10 million. And then we also know from children, so ages 18 and below who are taking care of someone, that's 5.4 million. So there's so many of us who've been impacted. We all know a caregiver, or we're either going to be one at one point in time.
Yes, yes. And so many times people don't know where to turn. I mean, Carrie, what was your struggle with finding support? Or did you even think about what you needed to support you?
No, well, that was the problem for me. I couldn't get past the moment of keeping all the balls up in the air. People would say, oh, there's resources, but they weren't readily available. And I felt like I had no help in a lot of ways in connection to these resources.
Or people might say, what do you need? And
I would draw a blank. I really would. And then
I knew, I'd be better off.
Exactly. But what I found towards the end was if you can get to a place of asking for specific help, there's loads of people in our family and extended family that were willing to, but they needed the directive. Be here. Can someone be here Tuesday from 10 to 4? Can someone come? Yeah. There were weeks where I didn't get out of the house because I just couldn't think clearly enough to ask for that specific help.
If you're just tuning in, this is Nashville, and I'm your host, LaTanya Turner. Today, we're talking with and about family caregivers as part of our Next Age series. In the studio with me now is Carrie Pagetta, a family caregiver for her mother, who recently passed away, and Dr. Phelan Lewis, who has done quite a bit of research on caregiving. Dr. Lewis, let's talk a little bit about what you are finding or what strategies you can offer for the inevitable when it comes to this role. As with Carrie, many times there's grief even before the care recipient passes away. But now she's in this moment of grieving and trying to, I'm assuming, re-establish your own identity.
That's absolutely true.
So what can you say about that?
Yeah. So the first thing I think of is you absolutely, it's so cliched, but you really want to make sure as a family caregiver, you are putting that mask on first, right? Like you are taking care of yourself first. You cannot take care of anyone else if you are pouring from an empty cup. Mm-hmm. So that definitely means, we support the organizations that we have in our community, such as the Tennessee Caregiver Coalition. Also you want to make sure that you are getting respite. And what we mean by respite is those structured, frequent breaks from caregiving. That's something that's phenomenal with the Tennessee Caregiver Coalition, is they provide vouchers so that you do have those times where you can have breaks, where you can have someone take care of your loved one. And all of that, you really want to work on that preservation of yourself. So that's your mental health and your physical health. So make sure that you're getting out there, being able to make sure you're maintaining your own healthcare needs, because we see that in the research that we do of family caregivers. They are under so much stress and so much strain and just truly trying to survive and get through the day that they neglect their own healthcare needs. And
I was going to ask about talking about it, because I have had my own caregiver journey, and I found when I did talk to someone about it, so often you would find community. And I guess I'd like you to explain how that can be a strategy.
Yeah, absolutely. So we know that there's strength in numbers, and I think it's just affirming to hear that you are not alone. We know that caregivers struggle with isolation. You're just trying to survive and get through it. And all the things that happen, you never know what you might be waking up to as a family caregiver. And you're just trying to get through the day. But if we are able to speak out and share that, hey, I'm a family caregiver. I'm not ashamed. I'm proud of what I'm contributing to my family. You'll find that there's others who are right in that journey, right alongside there with you. And I think that's so important for us to know we're not alone in this. There's millions of us doing care every day.
That is so true. Carrie, this is a great opportunity for you to ask Dr. Lewis something. Is there something now that you are in this particular stage of the journey after your mother has passed? Is there something you'd like to ask Dr. Lewis?
That's an interesting question. Well, I have a theory. I don't know if you can speak to this, but, I called my pre-grief anticipatory grief because I was sitting in it and I knew what was coming, especially towards the end. And then after my mom passed, I kind of had this, I wasn't really prepared to talk about this, but I'm going to go for it. I had this visual of a pie that, because I had really processed and felt and walked and carried my grief before my mom passed, is it possible that I have grieved some that, I really thought I might be debilitated after she passed? This was in the beginning of the journey. And now I'm functioning. I'm happy to be re-engaged. I'm seeing people in the world, and we have a freedom to, we call our family the Pajedi foursome, and we have an opportunity to be out in the world, all four of us, So is it possible that I have grieved some and it might not hit me?
That's a fascinating question. I know what you mean. It's like when the end ultimately comes, you're like, why am I not collapsing? Why am I not, like you said, debilitated?
Yes.
But maybe you've pre-grieved.
Exactly. You use the term spot on. We call that from research anticipatory grief. So your body has gone through those stages, the 5 stages of grief already. And we know, though, that process, the human body and our mind, all that is a wonderful process. So we know that may continue on. So what we say to caregivers is give yourself grace. You never know what mood you may wake up in, what may hit you that day, what may trigger, feelings that you thought you had accepted or put to rest, but give yourself grace as you go through this process.
And don't feel guilty if you aren't melting down at the end, because you have anticipated it. But is there also the likelihood that it might hit you one day?
Exactly. Right. I mean, you hear from family caregivers, they'll be in the grocery store and a song would come on that reminds them of their family member and break down crying, and they thought they had gotten over their grief. I don't think there's any way you get over the loss that you have for someone you love and love deeply and invested in like you have. So, and in that saying, give caregivers grace and give yourself grace as a caregiver, but it's also, it's not uncommon for them to say, actually, I felt relieved when my loved one passed because they were no longer suffering. Right. So all of those, it's complicated and complex emotions. It's okay to feel all of them at any stage.
And, I believe that sort of knowledge is helpful because then it makes you feel less alone, or makes you feel like you're normal to be on this ride with it. It's like a raft, and you just have to take the flow as it comes.
Absolutely.
That's helpful.
What about someone like in Carrie's situation who has young children and a spouse? So no matter what you're experiencing, they may be having a different experience. Any advice for someone like that, the sandwich generation person?
So we say family conferences are really important. That's just a fancy word to say, let's just have a sit-down meeting and talk as a family. Have an opportunity and create a safe space for your partner, for your children, to be honest and authentic about what they're really feeling. And especially for the children that are in the home, we also want to make sure that they feel that they have the agency and autonomy to say yes to caregiving and even say no. If there's maybe some tasks that they don't feel comfortable with, give them that space to say, I'm not sure if I feel comfortable doing that. And that's okay, right? That allows people who were a part of that caregiving team in the home to feel empowered with the choices they have of caregiving. It's a choice rather than it's a must do or it's put upon me. That helps us prevent resentment in caregiving.
Wow, that's really nice.
We just have a couple more minutes, but your story is so interesting, your personal story that led you to this area of focus. Just quickly tell us about that in about the next minute.
Sure. So I consider myself a senior generation caregiver, but in a different way. So I take care of my disabled mother and also my grandfather. So my mother's father, he has kidney disease and prostate cancer, and he also now has Alzheimer's and vascular dementia. So he's at that age. And then my mother, because she was disabled when I was age 11,
wow,
I started taking care of her since a child, and I continue to take care of her to this day. And that has definitely been an experience where I say the good is that my life's work has come out of this, the advocacy, the research. But I also know day to day, it is a struggle and it is hard. I can very much relate to what you've shared as well. So in all of it, I would say, we know that we're not alone as caregivers. Whether or not you identify with the term caregiver or you're just a good son or a good daughter helping out, it doesn't matter. What you do is so important. We know that there's $600 billion of worth of care that caregivers are providing in this country. It's important what you do. Doesn't matter if you call yourself a caregiver or not, but just know that what you do is valuable, it's important, and you deserve support in that as well.
That is such an important message. Thank you so much for sharing those thoughts, Dr. Phelan Lewis, who is with the Vanderbilt School of Nursing, also a caregiver research, and Carrie Pagetta, my colleague here at Nashville Public Radio, who was a family caregiver for her mother. We're taking one last break. When we come back, a somewhat new and growing resource for family caregivers who need outside help but are determined to keep their loved one at home. Stay with us.
I'll stand by you. I'll stand by you. Won't let nobody hurt you. I'll stand by you. So, if you're mad, get mad. Don't hold it all inside.
Funding for This Is Nashville comes from Burr and Foreman Law Firm, serving clients with transactional, litigation, and regulatory needs. Discovering how each client defines a win and working with them every step of the way to achieve it. Burr.com.
I'm LaTanya Turner, and this is Nashville. We're wrapping up today's discussion about caregiving in our Next Age series. Did you know there are centers that offer day programs for adults who can't take care of themselves? Adult day service is a fast-growing sector in Tennessee, providing an option for family caregivers who want to keep their loved ones at home but need help with their care or social connections. One of the longest running in Tennessee is Centennial Adult Care Center, which has expanded from its original location in Nashville to now include centers in Mount Juliet and Murfreesboro. That's where I visited recently for a close-up look at adult day services. A simple game of kicking and tossing beach balls is more than it seems at Centennial Adult Care Center in Murfreesboro. This group of about 15 people seated in a circle range in age from 18 to 103. Most are over 60, and all need help with daily living or supervised care due to physical, mental, or age-related disabilities.
This keeps their leg movement going, their eye and their legs coordinating together to get this ball, and it's really good for them. It gets their heart pumping, and they just love it.
Kim Cameron is a certified nursing assistant who manages the care plan for all the members. Today, that includes music therapy.
When I point to you, if you could say your name, that would be amazing. Do you think we can do that? Yeah?
Every one of them has a story, and it's so interesting to hear, especially some of the veterans, to listen to some of their stories. It's amazing.
What's your name, sir?
Robert.
Robert. You say hi, and I say hello.
Robert Lee Sumlin. Sumlin, S-U-M-L-I-N. I was born August 15, 1950.
And you're a veteran?
I'm a veteran, yeah.
Were you in the Army? Or
In the Army.
Okay.
Army.
Tell me what you like about coming here.
We all kind of clown around with each other. I enjoy it.
Yes. Waste not.
The majority of our folks that come here, our members, have Alzheimer's, dementia, memory loss.
Good job. I'm going to ask
My name is Andrew Keene. I'm Vice President of Operations for Centennial Adult Care Centers here in Middle Tennessee.
Centennial is one of the longest-running adult care centers in the state, founded in 1991, and it's one of few that provide medical care in addition to social activities.
So you have a medical staff full of RNs, LPNs, and CNAs that can do medication, take care of incontinence care, feeding assistance. So one of the great things about adult day services is that we kind of cut the cost of the medical care in the caregiving space. So your assisted livings and long-term care are super expensive, and we're a fraction of the cost of that.
That's a game changer for family caregivers like Stacy King.
I was at the end of my rope with trying to figure out what to do.
Stacy's 90-year-old mother, Peggy, lives with her and has some memory loss and a heart condition. Since becoming her caregiver, Stacy has given up her nursing career, closed her business, and spent down her own retirement savings. Still, it wasn't an easy decision to seek outside help, eventually enrolling her mother at Centennial.
I felt guilty. I'm like, no way, I'm not doing that. I can take care of her by myself. I'm Wonder Woman. She's not going anywhere. And seeing her now in this facility, oh my gosh. She eats, she's happy, she gets up in the morning, gets dressed. They all know her, they're kind to her. She's kind to them, she gets to crack her jokes.
Hi, Miss Peggy.
Hello.
How are you?
And that's just what I saw when I met Peggy at the center.
How do you feel about coming here every day?
Oh, I'm okay as long as I can go back.
So as long as you can go home at night.
Yeah.
That's one attraction of adult day services. They allow people to age at home. The centers are licensed and regulated by the state of Tennessee and routinely inspected.
We pride ourselves on keeping people out of the hospital and reducing falls and fall risks. And those are the sets of data that we have presented and has really caught the attention of Medicare and Medicaid services and others. And I think that's hugely important for every healthcare setting in the industry.
And for family caregivers like Stacy King.
For me, it has given me a chance to be happy, to not be so stressed. So it's given me a chance to just be me again.
Like music?
Oh, yeah. I love music.
Tell me what.
Back at the center, Peggy is finishing lunch and ready to sing.
The beautiful, beautiful river.
Memories revived by music and social connections in a caring place is helping to reframe how many think about growing older.
Is that right?
That sounds.
Here's Robert Sumlin again.
I go and come every day, and I ain't had no kind of serious problem. Well, it's an old field like me. It feels pretty good, you know.
The beautiful, beautiful river.
I actually had fun doing that story and meeting those folks. Joining me now is Bill Zagorski, Director of Centennial Adult Care and Chair of the National Adult Day Services Association. Welcome, Bill.
Thanks, LaTanya. It's great to be here.
Yes, thanks for joining me. You know, we often hear people say, I want to age at home, or I want my loved one to age at home. Yet I'm finding that a lot of people are unfamiliar with adult day services. So tell me what you're doing to get the word out.
it's a combination of anything and everything. And I can't count how many presentations I've performed, and the title is always, Adult Day Services, the best kept secret in long-term care.
Yes.
And Adult Day is different in every state. It's different in every city. It's different in every location. So it's hard to have a national picture of what Adult Day services are. But it's a professional setting that provides the assistance with activities of daily living. But of course, it also provides the physical and the cognitive and the social and the health support that allows individuals to age in place, and even more importantly, gives caregivers the break that they need, and all at a fraction of the cost. So it is difficult to have a national public media campaign to educate when you have 5,000 different locations. And many people have said, if you've been to one adult day center, you've been to one adult day center. So you have to visit about 4,900 more to really get a picture of what it is.
And I think it's important to establish what they are now, because I believe there might be some historic images about group homes or that are negative, have negative connotation. But your centers are regulated, inspected, and I think the medical model concept is very interesting too.
Yeah, it really has been an evolution over time. Adult Day has been around really since the 60s or 70s, but it really saw a significant growth in the late 90s, early 2000s, where it became, a little bit more accessible, really concentrated in the not-for-profit space and in the social model space. But as caregivers continued to age, as individuals wanted to remain out of nursing homes and out of assisted livings, then what was the other option? So Adult Day kind of, went into, the version 2.0 or version 3.0, where you really see the growth of kind of medical adjacent models. And here in Tennessee, there's no licensure difference between adult day services from a social and medical aspect, but the ability to serve individuals with a higher, chronic condition or a higher disease acuity allows us to provide those services in that safe environment. So you do see a significant growth in the medical models and a growth in the models that are age and diagnosis agnostic. So as you said, we have individuals as young as 18, as old as 103, and everywhere in between. It can be a challenge to find something that's enjoyable for everybody, but it's a challenge we live to meet every single day.
And is it accessible? We talked about your 3 locations, and there are others. 50 Forward has adult day services, some other organizations. But what about the rest of the state, statewide?
Yeah, statewide, there's about 45, 46 programs licensed by Department of Human Services in the state of Tennessee, and there's another, half a dozen that meet the respite exemption. There are a lot of faith-based respite organizations that offer some part-time service. So accessible, I guess it would be depending on who you ask. There's probably room for 500 programs across the state to function very easily. So it's accessible if you live, within a certain geographical location towards them. So I would prefer if we added a 0 to the number of programs, but it's getting there. We'll put it like that.
Okay. Well, we don't have much time left, but I do want to talk some about cost and policy changes that are happening currently with the current administration. There are a lot of cuts, and I know that you are very active on the national level with trying to address federal policy. Tell me what's happening with that as it relates to long-term care and adult day services.
Yeah, and there's obviously, it continues to grow and change every day. Adult day is still, majority of adult day funding across the United States is provided by Medicaid system. It is down from, 70-80% down to, closer to 50% from where it was, 15 years ago. And it's not that Medicaid pays for less, it's that other providers and other programs are paying for more. The VA, if you're a veteran, is now the second largest payer of adult day services in the United States. And here in Tennessee, it's followed pretty closely by Family Caregiver Support Program funding, which is funded through the Older Americans Act. And of course, all of these are national funding pots or they're streams that are matched by the state. So there's a lot of talk in Congress with budget reconciliation on the potential for Medicaid cuts. We're in a unique position in Tennessee in that we're in a conservative state that the changes in Medicaid will not have significant effects on the long-term care system here in Tennessee, but that's not replicated in other states, especially in expansion states. The Older Americans Act funding is also something that was not included in the budget reconciliation process, but I believe Senator Collins is introducing it's the Lifespan Respite Reauthorization Act, I think this week, to have the Older Americans Act refunded until 2030. But there are some other programs that have recently, kind of started to grow, where CMS or Medicare has this new guide model, which is guiding improved dementia experience. So there's pluses, there's minuses, there's a lot everywhere in between.
And I'm sure you'll keep an eye on it and continue to engage and help provide the services and support that we need for family caregivers and others. Thanks so much, Bill, for being here.
My pleasure. Thanks for having me.
Yes. And thanks to all of our listeners for tuning in this hour. This is Nashville is a production of Nashville Public Radio. Today's episode was produced by moi, yours truly. It was directed by Tasha A.F. Limley. Our board operator is Liv Lombardi. The masterminds behind our theme music are LaRange and Namir Blade. Special thanks to the Greater Nashville Regional Council Aging and Disability Services and Tennessee Caregiver Coalition. Our Next Stage series is made possible in part thanks to support from Blue Cross Blue Shield of Tennessee and the West End Home Foundation. Listen back at thisisnashville.org or wherever you get good podcasts. The conversation doesn't end here. You can comment and tell us what you want to hear on the show by leaving us a message at 615-751-2500. You can also find us on Blue Sky and Instagram and X at This Is Nashville. And This Is Nashville. I'm LaTanya Turner. Tune in again tomorrow, everybody, and have a great day.